Okay, so this beautiful 25-year-old really just wants a little bit more definition to her nose. And what we're going to do is try to add a little bit of a dorsum. And she wants a little bit more definition to the tip. Now from the side, she has a slightly retracted columella here. So what I like to do is actually image what I think I can achieve with just a simple online app. We'll show you that in a minute. And then we'll see what I can achieve in real life. Okay, so I'm just going to be capturing her picture right here with just this online app. You can see right there. So we're going to use that photo. And then I'm going to go like here. And I'm going to try to see if I can simulate what we're doing right here. And I have to be a little careful because she's got very beautiful long eyelashes. You can see as soon as I augment this, see how flat the tip looks. So now what we're going to do is add a little bit more to the tip right here and right here. And I want the tip to be just a tiny bit higher there. And I need to bring down this. It's hard to show on here. We'll bring that down just a little bit. So now I made just a little bit right here. And I think if we go to something like this right here, you're seeing an estimate roughly of what I think I can achieve. Perhaps I'd like to get a little bit more definition in the tip. I'd rather underestimate than overestimate. So we'll go ahead and proceed. Okay. There was a recent study that just came out showing, and I discussed this with the patient, that the greatest risk of blindness from all facial injection areas comes from injection to the nose. Now I'm using a 25 gauge blunt cannula, which has been shown to be a little less risky than a 27. The 22 would be even less risky. The problem with that is I don't feel like I get quite as much precision in placement. And so we're using the cannula, and I feel that right here, I can add the product with less risk utilizing a cannula. You'll see that I'm constantly moving that the second way to avoid movement. Now, once I get some product in here, I believe that I can go ahead and inject right into the product because I know I'm putting it right along the bridge and have less risk, and that will hopefully displace some of the blood vessels that way. I also feel that with the cannula, I'm able to get a straight line shot here. So I think there's multiple advantages to the cannula. Perhaps it's not quite as good in the tip, so I may transition and do kind of a hybrid technique of utilizing the cannula plus a sharp technique, but I'm really building up the dorsum here from the side, and I'm just threading along here, and I really get a sense of being able to lay down a nice straight line and building up the dorsum with the cannula. So far we've only put in 0.2, and you can see there's quite a change already. I typically average about 0.3 to 0.4 in the average dorsum, and we're going to just keep adding up here. So that's the advantage of this. I'm adding as I'm going down the nose here and just building her dorsum. Now, obviously this would be different in somebody who had a bump. She has a lack of a bridge, so we're adding a lot more product here. While we're using Restylane Lyft here as the first time around is my preferred, I sometimes will switch to Radius, which is a calcium-based product. We're now up to 0.3, and then she has a petite face. That's already making a pretty significant change. You can see right here. And again, I'm just constantly moving. I do not like to be in one place at one time. And we're just slowly adding into the tip. You can see we've created a nice little bridge. And we are now at about 0.4. And almost done, and I'll transition to rotating the tip up in just a minute. Okay, so we finished with the cannula technique. You can see she's got a really nice bridge right here. I'm going to try to give her a little more definition, get away from this roundish kind of tip that doesn't have quite as much definition. We're going to try to create a little bit more of a tip defining point right here. You may see some extrusion through the cannula site. I'm going to go to the other side. Okay, so this is my screen where I predicted, this is before, this is the predicted, and this is her right now. So we'll do again, before, predicted, there we go, before, predicted, and there. And let's have you rotate around here so you can see the nasal dorsum. She's got a really nice dorsum there, and the tip. So typically I ask my patients not to wear glasses for about 4 to 6 hours. The Restylane Lyft is FDA approved for a year. Some people get more, some people get less. Typically most patients are coming in at 9 months for a repeat injection because they don't want to completely go back to zero. But this should be pretty much where she stays at. Now tomorrow she may have a little bit of swelling just from the trauma. Now if I just were to put a needle in her nose, not add anything, she'd have swelling. So now we added a needle plus filler. So she may have a little swelling for 24, 48 hours in the face. She can put light ice on here, but most people just go about their daily activity, put their makeup back on, and really do well.